Hello humans, welcome back to Your Thoughts Are Valid and I hope you all are doing great. So today we are going to start with Unit 4, which is pain and its management. And this is part 14 of health psychology. So yes, this is the last unit we are going to cover. So let's see what we are going to study today. So today we will be understanding what pain is, the role of psychosocial factors in pain perception, in which we will study about subjective, affective, and cognitive processes. So let's understand what pain is. So pain is defined as a state of physical, emotional, or mental lack of well-being or uneasiness that ranges from mild discomfort or dull distress to acute, often unbearable agony, may be generalized or localized, and is the consequence of being injured or hurt physically or mentally, and that usually produces a reaction of wanting to avoid, escape, or destroy the causative factors and its effect. So let's understand this by breaking down the definition. So pain is defined as a state of physical, emotional, or mental. Okay, physical, emotional, or mental lack of well-being. Okay, like it is definitely physical, and then it can be emotional as well and mental as well. So basically, lack of well-being, be it physical or emotional, uh, and which causes uneasiness that might range from being mild to unbearable agony. Okay, and it can be generalized or localized, like you can have pain in your whole body, or it might be in some certain part, and it's the consequence of being injured. So it might be due to some injury, or maybe you are hurt physically, that's why you are having pain, or it can be mental pain as well. And it usually produces a reaction of wanting to avoid, escape, or destroy the causative factors and its effects. So I hope the definition of pain is clear to you. So pain is the emotional and sensory, both emotional and sensory experience of discomfort, which is usually associated with actual or threatened tissue damage or irritation. Okay, what tissue might actually be damaged, or maybe you are just threatening that it might get damaged. So both of that cause pain, or it can even cause you irritation. Then the term clinical pain is used when the pain necessarily requires professional care. Pain can be described as complex as well as multi-dimensional phenomena because it has multiple components, which are physiological, behavioral, cognitive, and emotional. Pain can negatively impact day-to-day functioning, social, familial, and work life of the individual experiencing it. It also has economic consequences, like in the treatment, a lot of money gets like you will have to spend a lot of money if you want to get rid of the pain. So it also causes economic consequences. So this is about pain. So I hope you are clear with the definition of pain and what pain is. Let's move on. Let's understand some of the characteristics of pain. So first, let's understand that pain can be progressive. Okay, like today it is mild, after a week it gets severe. So it is progressive, like it becomes worse over a period of time. And for example, arthritis. In arthritis, it starts with mild pain, but it increases, it becomes very severe. Then second characteristic that is that pain can be intermittent, that it fluctuates over a period of time, and its intensity may also fluctuate. So it basically means that it like like you might have pain today, you might not experience the same pain for like another week. So it can be intermittent, and even the intensity can fluctuate. Like today you have severe pain, after 1 week you might have mild pain. So that also fluctuates. Then the third characteristic is that it can be associated with an illness that is progressive, or its underlying cause could be malignant, or it can be harmless. So, like, you know, an illness which is progressive, uh, and pain is like one of the symptoms of that uh, illness, for example, arthritis itself. So it can be associated with that, and also like the reason or the cause of pain can either be serious or just like harmless. Sometimes you have pain because you might have bumped your head or leg against something, so you might experience pain for a while. So it's harmless, but if it is due to some serious illness, then it is malignant. Then pain can also be intractable, that is, it does not respond to treatment. So sometimes it happens, especially when, in the somatoform disorders, like when we experience pain and there is not no really physical cause behind it. So especially in those cases, pain cannot really be cured by treatment. So there are many treatments for pain, but they might not help. So we can say that pain it could also be intractable. Then it can also be recurrent, like it occurs at regular intervals, like you experience pain after every 1 week for like 1 hour, 2 hour. So it can be recurrent. Then pain can also be referred, that is, it will originate from one area of the body, but it is perceived as originating from some other area. Okay, like it's originating in some other part, but like you are experiencing pain in some other part, but it is originating, like the origin of that pain might be somewhere else. Okay, like we can say this happens in migraine. Okay, so yes, this is about pain, characteristics of pain. Let's move on. Let's understand what is the difference between acute and chronic pain. So, acute pain usually comes on suddenly and is caused by something specific. It is sharp in quality and it usually doesn't last longer than 6 months. It goes away when there is no longer an underlying cause of the pain. And causes of acute pain might include surgery. So, like you might have undergone surgery. So, like you will experience pain because you have undergone the surgery. There were cuts in there, like the doctor made some cuts in your body. So obviously it will pain for a while. So that kind of pain is acute. Then you might get your bone broken. So that is also acute pain. So because it will happen for a while. After plaster, it won't really pain, but at that very moment, it pains a lot. Then also dental work, you might have some infection in your tooth, or you might getting wisdom tooth. So that is also acute pain. Then burns or cuts, you might get burnt, or you might, end up while working with scissors or knives, you might hurt yourself. So that is also acute pain. Then labor and childbirth is also acute pain. But after acute pain goes away, you can go on with your life as usual. Then what is chronic pain? Chronic pain is the pain that is ongoing and it usually lasts longer than 6 months. It can even continue after the injury or illness that caused it has healed or gone away. Okay, then pain signals remain active in the nervous system for weeks, months, or even years. Some people suffer chronic pain even when there is no past injury or apparent body damage. So sometimes it happens like some injury happened and you might experience pain even after 6 months, even after years. So it happens because pain signals remain active in the nervous system. While sometimes pain can be there, although there might not be any injury or any body damage. Let's move on. So chronic pain is linked to conditions that include headache, then arthritis, then cancer, then nerve pain, back pain, then limited ability to move around, lack of energy, change in appetite. Chronic pain can also cause emotional effects, including depression, anger, anxiety, fear of re-injury. This fear could limit your ability to return to work or leisure activities. So I hope it's clear till here. Then let's understand role of psychosocial factors in pain perception. Psychosocial factors play a significant role in pain perception, in influencing how individuals experience, interpret, and cope with pain. These factors can modulate the intensity, duration, and overall impact of pain on an individual's well-being. Here are some key psychosocial factors that contribute to pain perception. There are many, but here we are just learning about two. Sorry, here we are just learning about five. Okay, first one is emotional state. Emotions like anxiety, depression, and stress can amplify perception of pain. Negative emotions can sensitize nervous system and make pain feel more intense. Conversely, positive emotions such as relaxation and happiness can have a pain reducing effect. Then another one can be cognitive factors. So an individual's thoughts and beliefs about pain can shape their experience. For example, catastrophizing, which means exaggerating negative aspects of pain, can intensify pain, while a positive attitude and self-efficacy, that is, believe in one's ability to manage pain, can help reduce its impact. Then there is social support. Social relationships and support networks can influence pain perception. People who feel supported by friends, family, healthcare providers tend to cope better with pain. Social isolation or lack of support can make pain more distressing. Cultural and societal factors. Cultural beliefs and societal norms about pain expression and tolerance can shape how individuals perceive and communicate their pain. Some cultures encourage stoicism. Stoicism means, like ignoring your pain, basically not speaking or expressing your pain. While others believe that, expressing your pain might really help you. Then personality traits are there. Certain personality traits, such as neuroticism or resilience, can influence how individuals process and cope with pain. Neurotic individuals may be more prone to heightened pain perception due to their tendency toward negative emotions. Then let's understand role of psychosocial factors in pain perception. Uh, Here we will focus majorly on subjective, affective, cognitive processes in health psychology. So psychosocial factors play a crucial role in pain perception through subjective, affective, and cognitive processes. Health psychology focuses on understanding how psychological and social and behavioral factors interact with physical health and illness. Then, in the context of pain perception, these factors contribute to the overall experience of pain and can influence an individual's ability to cope with and manage pain. Then here's a breakdown of how subjective, affective, and cognitive processes impact pain perception within the realm of health psychology. So first, let's understand subjective processes. So first one is pain. Under subjective processes, we need to understand two concepts. First is pain interpretation, then second is pain communication. So under pain interpretation, we cover like how individual is actually interpreting and giving meaning to his or her pain. So the way individuals interpret and give meaning to their pain influences their emotional and behavioral responses. Cognitive processes such as assessing the threat level of the pain or attributing its cause shape the overall pain experience. Then there is pain communication. So it like the second aspect of subjective process. So it covers how individuals communicate their pain to others, including healthcare professionals. It is influenced by their subjective experiences. Effective communication of pain experiences is crucial for accurate diagnosis and treatment. Okay, so under subjective processes, we studied about how the individual is interpreting the pain and like how much he or she feels threatened by it or its causes. And in the pain communication, we studied like how the individual is communicating the pain with the family members and the healthcare professionals, because that is necessary for accurate diagnosis as well as treatment. Moving on. Then there are affective processes. So under affective processes, again, we need to understand two concepts. First is emotional states. Emotions like anxiety, fear, depression, and frustration can heighten pain perception. These emotions contribute to the emotional component of pain, making it more distressing and difficult to manage. Okay, so like if you are too much anxious about your pain, it will make it more difficult for you to manage it. Then pain related distress. Negative emotions associated with pain can lead to increased distress, impacting an individual's overall well being. Managing these emotions through interventions such as cognitive behavioral therapy can improve pain outcomes. Okay, then there are cognitive processes under which we need to understand three concepts. First is cognitive appraisal. So it is about how individuals assess significance and controllability of their pain. These appraisals influence emotional responses and coping strategies. A perception of limited control over pain can lead to increased distress, while a sense of control can reduce distress. Then there is cognitive coping. So cognitive strategies such as cognitive restructuring and thought suppression can influence how individuals manage pain. Positive cognitive coping strategies can enhance pain tolerance and reduce perceived pain intensity. Then what catastrophizing? Catastrophic thinking involves magnifying the negative aspects of pain and expecting the worst outcomes. This cognitive distortion can amplify pain perception and hinder effective coping. So this is about cognitive, effective, and subjective processes under psychosocial factors and pain perception. So I hope everything is clear till here. If you have any doubt, please do ask in the comment section. And that is it for today's video. Thank you so much for watching. I will see you all in the next video.